Good
Morning to everyone. Dr. Samani, are you online? Good morning. Good morning. Am I audible? Good morning.
Good morning, sir. You are audible.
Good morning, sir.
Can we start now? Are we ready to start?
Good morning, sir. Yes,
so we can start. Yes, we can start.
Okay.
You can start. Good morning.
Now, our topic is about clinical research, and we'll try as much as possible to be as exhaustive as and as well as clear, so that we will be able to have something to take home from this session. I don't often like making presentation like this because a number of us are not interested in the lecture itself per se. We are more into probably generating our regular CPDs. And I don't think with this kind of mentality, we're going to move forward. So please let it be very clear that you are here to take something home. It's not healthy that after attending this, no matter how little the amount you spend is, you should be able to have something that is positive that you are taking home. The lecture is lengthy, so we're going to have first 2 hours, I think. Then subsequently we take a break, then we reconvene to continue. Now, the first thing is, as therapists, you've been involved in one way or the other in research, particularly at undergraduate level, where you did your project. Often, what is the reason for asking students to conduct research at undergraduate level? A number of us as tutors or lecturers, we miss that particular path, such that we often engage students in something that is beyond their capacity. And a number of them don't even have, they don't really learn anything during the process of conducting their project. So when they graduate, the idea of understanding the basis for conducting the project is not there. And so therefore, if they go into practice, the basis for asking them to conduct the project does not continue when they go into practice. And why is it that way? Because a number of lecturers ask you to do something that is truly, truly impossible. Now, why do we ask students to conduct project? It is actually to introduce them to research world, for them to have a learner's opening their eye to what is research and understand the basics when it comes to research. So when they have this background knowledge, they may be able to develop themselves. Similarly, before you go into project, you did research methodology, you did statistics as an undergraduate student, and a great deal of undergraduate students learn literally nothing during the either research methodology classes as well as statistics. They struggle. Let me just make sure I'm able to pass. At least that is the basis for this. And after passing, you ask them any question about it, they know nothing. So for this reason, I decided that in this session, we're going to take it in a way that let's look at it from beginner's perspective. So for a great deal of attendance, this lecture is going to be at the beginning, it's going to be like elementary. Then subsequently we build up and see how we can grow. I hope from this session that we're going to have, in the next session that may be coming up any moment within the year, we can be able to link up what we learned today with what we're going to pick up at a later time. Then probably if we could, we may actually have this session, the next, and add another one or two to make it a lot richer. If you are able to attend this particular session and you are able to key into the subsequent sessions, I'm confident that you're going to change significantly in your understanding of what is research, how do we conduct research, and whether research is actually for academics or it involves the clinicians. So you don't necessarily have to be in the academic area or field before you embark on research. In fact, for me, I often consider research to be the property of clinicians more than the academics. While the academics are essentially interested in getting themselves promoted and significantly don't make use of what they found from the research field, they transmit it to clinicians to actually use their findings. Additionally, you also have situation where, since the academic is just a few of them that often attend to patients, except probably at private level, the chances of clinicians seeing new things that probably they've not seen in other patients before, which they actually question, or probably doing a particular practice consistently and they are not seeing results. And for this reason, they may think that, why am I not seeing results? Those kind of questions of, these are new things I've not seen. This is something I've been doing for a long time. Why are my patients not improving? Why is this technique not working out? Why do I have to use this gadget and not the other one? Questions like this are reasons why research has to be conducted. And therefore, for you to answer such questions as a clinician, you definitely will have to embark on research. So when you embark on research, you may be able to answer those questions and as well as address those problems you must have encountered during your practice. So let's move on. There are a number of authorities that actually defined. I hope you can see my slide. Is my slide visible? Is the slide
Yes,
visible?
we can see your slide.
Yes.
And I can slide show.
It's visible.
So we said the objectives is for us to understand and articulate research questions know and differentiate types of research, quantitative, qualitative, and mixed method, ascertain a research problem, identify the type of research design, and appreciate and understand clinical research process. So these are some of the things we shall be looking at. So by definition, research is seeing what everybody or everybody else has seen and thinking what nobody else has thought of. Zenz actually defined research as something that literally everybody can see it, but then what you're looking at in it is completely different. Let me give you an example. In practice, we know what is osteoarthritis of the knee, and we've been treating this condition for a long time as physiotherapists. And we use various gadgets in treating the patient. Now, there is this case of an undergraduate student who said, I have a problem with how patients with OA knee are being handled by physiotherapists. And the question I asked the student is that, what problem do you have? He said, we went to the clinic and the physiotherapist in charge who was actually supervising us told us to expose this patient to infrared radiation. And we treated the patient and the patient left. And after the infrared, we were asked to massage the knee and the patient left. Now, the following day, this patient was around and the therapist asked us to go and get the infrared. And it seems somebody else was using the machine. So he asked us to take the patient to where we have a tunnel bath and we should tunnel bath the patient, which we did. And after it, we were asked to massage the patient and the patient left. Subsequently, the patient resurfaced. Another day, the tunnel bath was busy, the infrared was busy, but then we actually have shortwave diatomy, and luckily for us, it was free, and he asked us to use shortwave diatomy, which we use. We were asked to massage, and we massaged, and the patient left. Another day, the patient was there. We couldn't find infrared, no tunnel bath, no shortwave diatomy, and we were asked to go and get cryotherapy. We did, we massaged, and the patient left. Now, the student was like, luckily, when he came back the 5th time, the infrared was available, so we went back to infrared. Now, the reason is, the problem here is, sir, why do we have to be using various gadgets? Because of non-availability of one, we decided to go, why do we switch to another one? Are we expecting the same outcome from using these gadgets? Or we just use them? What do we actually depend on in trying to choose that? And I said to him, the thing is probably they all think because since this gadget are all producing heat, and that's why they said, let's just continue to use the heat. And he said, sir, but we also use cryotherapy. Cryotherapy does not provide heat. Now I have a challenge. How do I convince my patient? I said, my student, I said, they are all targeting pain. And since cryotherapy can actually work on pain, that's why they decided to choose it. So the problem I have here is, do they provide the same effect? And that is a good question. And this is what I'm saying. We see what everybody else can see, but do we think of what nobody else has thought of? So this is it. So as a researcher, your sense of thinking, the way you look at issues is a lot wider than what ordinary persons actually look at it. So the point is, even though something is ongoing for a long time, you tend to understand that there must be a reason why this is going on, and you want to find out what is that. Recently, I was with a postgraduate student, and we were discussing about treatment of neurologic conditions, and in particular, we made reference to stroke. And they made me understand that the term PMPNF is a common thing that everybody documents in their plan for managing neurologic condition, in particular stroke. And they said, we consistently write this, but we hardly do anything. We knew that we usually do the PM, but then the PNF part of it, how often do we do that? And you ask yourself, they now say, why do we even document that? When we know we're not going to do it, when we know we don't do it, then do we actually have the skill set for us to implement PNF, or we do not have? So how many people can actually confidently apply PNF? And again, why do we even write the PNF? Is PNF actually effective in the management of neurological condition like stroke, or it doesn't? Questions like this are necessary when it comes to practice. And in particular, why do physiotherapists go for that? Why do they choose this? So now, having the kind of sense for you to go beyond board and say, why is this done? Why do we have to do ABC? Is what a researcher is supposed to continue to ask such kind of a question. Okay, research is regarded as a careful investigation for new facts in any branch of knowledge. It doesn't matter the field, your major reason is for you to look for what are the new facts available. You want to know, is there a new thing being discovered, or you actually want to come up with something new? According to Redmond Murray, research is research is a systematic effort to gain new knowledge. So this is one of the reasons why we conduct research. Clifford Woody detailed his definition by actually coming up with different sections of research. He said, defining and redefining problems, formulating hypotheses, stroke objectives, collecting, organizing, and evaluating data, making deductions and reaching conclusions, testing the conclusion to determine whether they fit the formulated or formulating hypothesis stroke objectives. So he, in his definition, he looked at holistically the processes of research. He embedded it in trying to define research. So we're going to be looking at some of these processes as we move forward. Research can also be simplified as an organized and systematic scientific investigation formulated to solve problem, test hypothesis, and develop or discover new knowledge stroke products. So this is also another definition that is looked at. What are the key features of clinical research? In clinical research, we know the process is systematic, which means it's actually organized into steps, which are meaningful steps that you can easily relate with. All steps must be interrelated, one step to another one. They must be logical. We should be able to reason and agree with the process of conducting the research, as well as we know where we're going. Agreeing with the principles of logic, your research must do that. Empirical conclusions should be based on evidence stroke observations. So we should be able to relate the finding of a research to something that is conclusively meaningful and can be related to evidence. Objectivity must answer the research questions. What are the questions that are set at the beginning of the research? Then your research should be able to attain to those objectives. Replicable. This is one of the areas that I always like students to appreciate. The replicability of a research. You oftentimes when students come up with a methodology, they do not bother whether somebody else can actually implement that method to arrive at the same findings. Their target is, this is the method and this is what I want to follow. And at the beginning of a research, you also have a problem. One of the problems you have is that there is no this interest in getting the world to understand the process of conducting the research. And at the end of the day, in fact, you even have situations where people do a research and they themselves cannot replicate the research. A friend of mine was talking to me about his elder brother who was working in the laboratory. And one day he was trying to come up with a certain chemical. They have a lot of cockroaches in their house. And he felt that if you want to come up with a chemical that can kill the cockroaches, he read some books and he came up with a formula. But he put the formula together and he realized the formula wasn't working. So he started dabbling into different things. And after a while, he came up with one chemical, and that was a unique chemical. Right there in the lab, wherever there was a cockroach, because of the, let's say, is it the scent or the, yeah, let me put it that way, of that chemical, all the cockroaches in the lab all gathered around the chemical. And he now killed literally all the cockroaches. Now, what the chemical was able to do is not to kill the cockroaches, but to attract all of them out of wherever they are saying, the small, the big, the whatever size, they all came out en masse. But then this guy was not writing down the procedure. And subsequently, he tried and tried again. He couldn't come up with the chemical. Now, this is what I'm saying. You can have situations where people conduct a research, and unfortunately, they cannot replicate it themselves. Talk less of asking, giving out the process for other people to be able to conduct. Now, generalizability. It's not all research that we target generalizability, but to a large extent, research is supposed to be generalizable. And what we mean by generalizability is being able to apply it to a larger population. So when you conduct a research, there is that interest that we want that research to be applicable to a larger population. That is to say that a larger population can benefit from the findings of your research. So this is a key area of research. But then, like I said, it's not all researchers that the target is generalizability. In particular, when we divide research into two major designs, quantitative, qualitative, qualitative researches are not targeting generalizability, while quantitative do. And even in quantitative research, we have specific researches that are not generalizable. But to a very large extent, the target of a quantitative research is generalizability. Transmittable. The difference between transmittability and replicability is that replication is for you to be able to repeat the same research, while transmittability is for you to be able to take the findings of a particular research and be able to implement it in another setting. Let's say a research is conducted in the northern part of Nigeria, but then the findings is only applicable in the north, then it is not transmittable. But then suppose it can be applied to people in the south, in the southwest, in the southeast, and all of them will benefit from the findings. Then we look at it as a transmittable research. A research conducted in a low-income country like Nigeria should be able to permeate other low-income settings. So again, I want to repeat that it is not all researchers that their target is transmittability. We may not be able to transmit certain form of researches because they are probably localized findings, and they are supposed to be for the locals, and they are not necessarily transmittable to other settings. Quality control, then research should have accuracy, confidence, and reliability should be assured for a research. So we should be able to see the accuracy. So we should have certain level of quality control for a research. It's accuracy, it's the confidence that we have that this research is good. It should be a reliable findings, and all these are key important areas. Thrift is an area very important in research. You're trying to conduct a research about what people are used to, and assuming let's say in clinical settings, we used to often say that certain conditions can be managed using certain gadgets. Let's assume the use of TENS in the management of, let's say, back pain. Yeah. What is the cost of TENS, and how long does it take for you to use TENS? Cost effectiveness is not centered on money only, it also involves time. The minimum duration that is set for usage of TENS is between 30 to 1 hour. A great deal of research has indicated that for you to get a good result for use of TENS, you need nothing less than 40 minutes or 30 minutes to an hour when you apply it to chronic pain. Now, suppose somebody now say that duration is stupendously too high, but then I feel that therapists are wasting too much time, and I'm coming up with a gadget that can actually treat patients, and actually you need 15-minute application and you get the same result as TENS. That's on the one side. But then what is the cost of TENS? I don't think TENS is more than 30-something thousand to date. Quite a number of machines, you can still get them around that range. But then this machine that the person is introducing will be costing the patient nothing less than 150,000. Yes, the duration is short, but the cost effectiveness is not there. And again, we don't even know whether the outcome will be similar to that of TENS or better. So all these are key important areas. But then if the gadget can actually give us the shorter duration and the lesser amount of money to spend, and we have a good result, then we go for it. So you can come up with a gadget that is a lot more expensive, lots of time wasting, all because you say what you're doing is novel. It's nothing novel when you actually make life more difficult for people. All well designed and conducted research has potential for application. So literally all your research that you conduct, whether qualitative or quantitative, there must be an area that the findings of the research can actually create application. Then applicability here does not necessarily mean that we use it to get results, to resolve something. Applicability can actually mean that we are applying it because the findings indicated that what we are used to is actually wrong. For example, we've been using, let's say, tunnel bath to treat back pain because it's a large surface, and we decided to say that tunnel bath is very effective in the management of back pain. But somebody conducted a research and realized that the use of tunnel bath is literally a waste of time to patient, and there is no any result that we get from tunnel bath. So what is the application of this finding? Suppose evidence is overwhelming that the findings of that researcher is very accurate, and for this reason, we are supposed to probably stop using tunnel bath to waste patients' time. Now, the application here is that we have actually stopped using something that we are used to, which means it has helped us to reduce the waste of time and resources of both the hospital, the patient, and the time of the therapist and all that. So application does not necessarily mean that we are applying it. It could be for us to stop something, a practice that we are already used to, because our findings indicate that what we're used to is actually useless. Why is research key in clinical decision making? Research in health science targets transforming sound knowledge into practice, leading to clinical practice centered on evidence-based. Access to cutting-edge treatment. When you do research, you get that. Potential for more effective treatment is there. Monitoring of health, to see progress of patient, to see effectiveness of medications, to see effectiveness of practice, and all that are possible through research. Access to expert care. Yes, of course, we get this opportunity to help our communities is also there when we do research. Why do clinicians embark on research? So clinicians, they actually do it to validate their intuitions, improve methods of, treating patient demands. It could be part of the demand of your job, particularly for academics, for publications and patents. These are some few reasons for conducting research. So the next thing we're going to be talking about is a research question. So what do you mean by a research question? That particular thing that is coming into your mind about why is this like this? Why do we do this? Why do we do that? Or can we add this to get this result? How can we stop this and actually embark on something else? Those questions, those particular questions that you feel you want to know why this is done, what we call research questions. So research question, clinical research question is defined as an uncertainty about health problem that points to the need for meaningful understanding and deliberate investigation into that particular question. Why is this like this and not the other way around? To develop a research question, the clinical scientist should have a quality of being curious. So you must be curious for you to be able to ask this question. Let me give you an example. A student of mine some time ago actually said, I realized when women are about to put to bed, during delivery, and they get to the labor ward, and let's say the labor has not commenced or probably is being delayed, women are asked to take certain steps and be walking up and down to stimulate or augment the labor. And they walk through the corridor, up and down, up and down, up and down. And subsequently, probably the labor comes and they go to the labor room and the delivery is done. But then, how important, or why do we ask them to take such steps? Is exercise important at the level of labor, or it isn't? Is the number of steps a woman can take before going into labor, does it actually count? Does it have any meaning in labor? Is the level of activity of a woman before going into labor, does it have a role it plays during labor and delivery, or it doesn't? These questions only comes when you can think deep and relate. Do we ask women to embark on taking so many steps in their third trimester to boost their chances of having a safe delivery? Do we do that? How important is taking a number of steps prior to delivery? How important is it during the course of delivery? Questions like these are hardly do we ask such questions. It's a curious mind that will come up with these kind of questions. And at the end say, let me find out whether these questions are important, and therefore go on into deliberate investigation into those questions. Number two, or B, attentiveness to happenings around. Yes, you have to think about what are the things happening around me. Now, sometimes, I know sometimes we do see some of these comedies that or let's say pranks that are dangerously performed in Nigeria, where somebody will just shout and start running and people start running with him without knowing what is going on. Now, the question you keep asking yourself is that, why do they agree to run and without knowing what is happening? Why don't they pay attention to what is happening around them and see whether it's worth it to run or not to run? Or is it safer to just run and later find out what is happening? So you even have people jumping into dangerous places only because they had a sound. They are not sure of the source of the sound. They are not even sure whether the sound is around them or is even far away from them. Because all these things is because you don't pay attention to what is happening around you. As a researcher, you are a curious person who wants to know what happens around them. Now, again, the researcher must be an avid reader, somebody who embark on trying to read as much as possible. For those who are my students, particularly including at both undergraduate and postgraduate, they know it is not possible for me to ask you to write anything immediately and give me topics. I don't say give me topics. I often ask students to tell me what they are interested in. And along the line, I said, okay, if you are interested in ABC, can you go to the library and search as much as possible, whether on your phone or go to the library, but these are resources, go and read. When you're confident that you can answer a number of questions about this area that you say you're interested in, come back to me. And I ask you the same question, that how long do you think you can come back? A number of my students will tell you 2 weeks, but I have people spending 2 months getting ready to be able to face me so that we can discuss their what they say they are interested in. So the main problem we have here is people don't like to read. People are quickly jumping into coming up with topics, and that's why they encounter a number of problems, because you write a topic and they tell you somebody has done this. You write another one, they say somebody has done. If you've been able to sit down to read enough, you realize that you may not need to suffer that much to be able to arrive at a topic. So avid readership is very important for you to be able to develop research questions. What about collaboration with mentors or co-research enthusiasts? Now, when you collaborate with others, you share ideas, you discuss issues, you look at different areas, and you realize you'll be able to arrive at something. Recently, we were discussing with a postgraduate student, and he was interested in lower extremity function after stroke. And along the line, the student was looking at, let's say, activity of different muscles in the lower extremity after stroke. What role does each and every muscle of the lower extremity contribute in the function of the lower extremity? Let's say anatomically and physiologically, what is their role? And kinesiologically, what percentage of role does each muscle of the lower extremity actually contribute? Now, if you look at, let's say, for example, dorsiflexors, in particular the tibialis anterior. So what percentage of the dorsiflexion is actually provided by tibialis anterior? And again, the question is it tibialis anterior only that actually participate, bring about dorsiflexion, or do we have contributory muscles? And what percentage of contribution do they make in dorsiflexion? So if we understand this, now, how much of their role is being affected when somebody suffers stroke? Now, it takes a curious mind for you to come up with something like this. So hardly do we say, okay, if we now know that this is the level at which each muscle is affected, which means we can decide to say, can we target each muscle in our treatment and say that our target is tibialis anterior, our target is this muscle, our target is this, our target is that. And at the end of the day, will be able to address patient need in a more distinctive way or more scientific way. Instead of us to say, oh yeah, we are trying to strengthen the dorsiflexors, and our attention is paid to, let's say, tibialis anterior, neglecting or ignoring other muscles that are contributing to the function. So since those muscles have not been treated, then the dorsiflexion will only reflect the action of tibialis anterior. Now, when we were discussing this with the student, of course, there is another student there, and he now said, oh, then I have an idea. So what if there is a variation between plantar flexors and dorsiflexors? So if the percentage contributed by plantar flexors is higher than the percentage contributed by dorsiflexor in the stability of the ankle joint, and this variation becomes more magnified after stroke, then there is more likelihood of instability, because the function, of a particular muscle has become completely overwhelmed. So the thing is, he now said, sir, I think while he's looking at this area, I will be looking at the other area. So let's see if we put this together. Somebody is looking at one side, the other is looking at it. So by the time we bring out these two findings, we'll be able to see a lot that will contribute to not just practice, to knowledge and so on in the management of persons with stroke. So it is only when research-minded people, enthusiasts, actually relate to talk about issues, you now see them coming up with different ideas, and more meaningful things will continue to come out and all that. So for us in academics, sometimes we pull our students together to see how reasonably they can think and come up with something that will actually contribute to not just patient care, also, but also to academic findings and all that. Okay, quality of research questions. I often say, do not let methodology drive the question. What is the quality of your research question? Is your research question qualitative enough? Is it good enough? If the question is not good, then I'm telling you, you are likely going to come up with something that is meaningless. So if the research question is good enough, you're likely going to come up with something that will benefit literally everyone. So clinical research should be formulated to meet certain scientific criteria. A certain summarized criteria has been produced to guide formulation of research questions. They call it FINGER. And in FINGER, F actually signifies feasible, B, interesting, it should be novel, it should be good, ethical, and relevant. So all these feasibility, sometimes if I talk about feasibility, a number of students actually encounter a problem when they do not do a feasibility assessment before they embark into a research. I'll give an example. There's this guy who actually wanted to conduct a study on spinal cord injury, and he wants to see exercise in improving upper extremity function to propel, to ease the life of persons with spinal cord injury. And he calculated the sample size, and the sample size was so high that you wonder whether in every street in Nigeria or every street in the city he lives, there must be somebody with spinal cord injury. So I think he has literally about 500 persons that are supposed to be part of his research. And it is an experimental study. Now, he gave it to his supervisor. The supervisor happens to be someone not in the field of physiotherapy, but in exercise science. And he said he was going to start conducting the study. So he invited the supervisor to come the day he was to start collecting data. And all the persons he could get were just 4 people that came to the scene of the the setting of the research. So the supervisor was like, you say you're going for 500. How can you start with 4? I should be seeing like 20, 2,500 for a start. Why would you say you're starting with 4? Were you thinking I'm not going to come here? So when you're ready to start this research, call me. This guy struggled and struggled and struggled and could not pull up to 10 people for his research. He started going to hospitals and demanding for phone numbers of patients. When he contacted, it's either the patient is late or the patient is not interested in the research or the patient has left the town, and so on and so forth. Finally, he told the researcher that the supervisor, that I'm having issues with getting subjects. And you know what the supervisor said? He said, I think you thought I was not going to be around. So you are trying to, lie or come up with a fake data. And unfortunately, you are not successful. And this irritated the student as well, that he knew he wasn't trying to lie. But the problem is he couldn't get patient. Now, why did he have this problem? It was simple. He did not do any feasibility check. In fact, even feasibility can be done not necessarily in the field. You can even do it in the literature. Then I asked this to the colleague. I said, why don't you check previous studies in this area? What has been their sample size? Do you know what is interesting? He realized most of the sample size are sometimes not even up to 15, and they are experimental studies for persons with spinal cord injury. Now, if he had done enough literature research, it's not therefore possible for him to come up with such ridiculous sample size and be expecting himself to be able to get such patient. And of course, going to the field will have as well explained things to him. So feasibility is key when you want to conduct a research. Now, your research should be interesting. You should not be embarking on something that is not in any way attractive. And you should be able to use terms that will attract attention. We did a study, and it's about trying to check oral hygiene in persons with stroke. Our interest, we want to look at the hand dominance in determining oral hygiene after stroke. And the key things we are looking at, our research question is it possible that if somebody's dominant hand is actually affected, his chances of taking care of his mouth will actually reduce or not? And we sent out this, after our study, we sent it for publication, and the study was rejected twice. We kept looking at why are they rejecting our study. Interestingly, we later realized that we said assessment of oral hygiene in stroke patient. Assessment of oral hygiene in stroke patient. And some other terms, I can't remember some of the terms we use, but the terms are not in any way attractive. So when I sat down and I said, see, I think I know why we have this problem. And we now decided to change the topic. And we now say oral hygiene after stroke. Then we put a column and we say, does upper extremity function matters? In the first time, the journal we sent it first instantly accepted the article. You can see, because the title itself is already a lot attractive. So you see, if it is interesting, there is every likelihood that people will be interested in trying to see what is it that you've done, and they will key into it. Novelty is also an important issue when it comes to research questions. Novelty sometimes is a lot challenging. But then I don't think there is a research that does not have certain level of novelty, even if it is a replication that you're doing. What is novel about it? What is novel about a replicative study is that it is being replicated. That is the novelty in it, because we don't know whether we're going to generate new information. So we should prove that going into the field to replicate this study may actually generate new information. And we must be able to put it in a language that shows clarity and why going back to the field is very important. For a study conducted 20 years ago, and the finding is still being used, we definitely know that there are many things that have changed in the society, and possibly these changes could actually bring about a change in what we've been using 20 years ago. So how do we indicate and tell people that we're actually replicating this study? And one of the reasons why we are replicating it is because the findings we're using have been there since 20 years ago. And we should prove that there are many things that have changed in the society, and these changes have actually affected ABC. But we wouldn't know whether it is going to affect this particular finding that we've been using 20 years ago. And for that reason, we felt it is important to embark on this study so that we check what is new. And of course, see whether the findings of the 20 years, existing 20 years may still remain the same, or there is need for us to change. Research questions must be good. Of course, they must be good enough that they send an information that there is need for us to do such study. Questions must be ethical. It shouldn't be a question that is unethical. Recently, we're talking about covert exploratory research. Covert ethnographic research. And when they talk about covert ethnographic research, is a situation where you go into the society, stay with them, trying to get information from them, pretending to be part of them while you are trying to tap information from them. And this information, they may not necessarily disclose it to you if they know that you are there to get that information. Now, the question is, since it is a research, is it actually ethical for you to enter into a group of people trying to capture information about them and without letting them know? Is it ethical? No. There is a lot of question when it comes to covert ethnographic research. A number of researchers actually said going overt is actually better than going covert. Overt research is where the people are actually aware of why you're with them, and they will be able to, you just let them know, probably not necessarily disclosing certain part of your research, but to a large extent, they know you're there to collect data. If you add one or two things to your findings, it is still better than a situation where they are completely unaware of why you're there. Then your research questions should be relevant. They must address the situation that they are meant for, and they should be able to come up with something that is relevant and could be accepted by not just the society, but by also the scientific world. Now, this is like additional information about the finger explanation on, what do you call it, research questions. Please, you can go through this slide. I think it's self-explanatory. It's also about finger. So what is the content of a research question? A research question or hypothesis should have a clear path that will guide towards selecting an appropriate research design. Hence, the clarity of a research question has been summarized into an acronym, which many of us know about it, which is PICO. PICO means population, intervention to be tested, comparison and outcomes. So a research question must have this content. You should be able to define the population that the research will be conducted on when you are setting your you're coming up with your research question. So at the end of literally every research question, there should be an indication that you always targeting this population. An example is, let's say, effectiveness of exercise motivation kit, motivation kit among women in Bielsa state. The effectiveness of exercise motivation kit among women in Bielsa state, or let's say among pregnant women in Bielsa state, among elderly women in Bielsa state. So in a way, we've been able to define the population because we told them that these are the people we're going to conduct the research on. So that's like talking about the population. The intervention that you're going to do should always be stated in the research question. Now we say effectiveness of exercise motivation kit. So the intervention here is the exercise motivation that we're going to introduce. Now comparison, if there is a comparison, it should be always clear. Now imagine we say in that research, we say exercise motivation among women in a Bielsa state, which means if we were trying to test effectiveness, in a way we've actually stated that there are women that will be exercising or using the kit, or would be educated about, would be motivated towards exercise, and there could be a certain women that are not involved in the exercise. Okay, we can say among exercising women and non-exercising women. We can make that clarity. It can be made clear like that. Though it's not necessary that you have to indicate that you have a control that are not doing exercise, but since you already said effectiveness, it indicates that some group are going to be exercising, but another group may not necessarily be exercising. Then you must have a clear-cut outcomes. Remember we said effectiveness, exercise motivation kit among women. So at the end of the day, we want to see whether some are actually motivated toward exercise, while some. So the outcome of the study is basically assessing level of motivation or success in motivating this group. So your RQ must have a quality of a PICO clearly. So what is a research design? We may actually be discussing the research design in a more detailed fashion when we come back from our second session, but then let me just give some brief here. There are three major approaches when it comes to research design, and in each one of them there are subsections of method. The first one is what they call quantitative. So quantitative research design, then we have qualitative, then we have mixed method. So under quantitative, we have several other methods that are all called, they are all forms of quantitative research. And I believe we shall be seeing them. Then when it comes to qualitative research, we also have different forms of qualitative researches. Essentially, people are aware of three major ones, which is the grounded theory, the ethnography, phenomenology, and so on. So these are some of the few things on the qualitative. Mixed method. Mixed methods also have varieties of mixed method. It could be sequential, sequential, what do you call it? Explanatory. It could be exploratory, and so on. So depending on what approach you give it. So we may be looking at some of these things as we move forward. Let me quickly ask this. Are you with me? Am I audible, or people are not hearing what I'm saying?
Yeah,
You are very audible and very interesting presentation.
Yeah, with you.
All right. So let's push on. Research design. Okay, differentiating characteristics. The first thing is we say goals. What are the goals of quantitative? What are the goals of qualitative? This session will look at more of what are the quantitative, what are the qualitative, than looking at the mixed method. If people are interested in mixed method, we can make it a very good advanced class where we're going to go very deep into mixed method, including the analysis when it comes to mixed method and how you can arrange your mixed method a lot. But then let's focus on the common ones, which is the quantitative. In fact, it's not even possible for us to talk about qualitative in this session. We are only going to talk it on the periphery. For a qualitative research, I presented something last year on qualitative, but it was a rush one. Probably this year, we will have a special session to look at qualitative research, where we're going to deliberate deeply into the content of qualitative and in different areas of qualitative and how we can conduct such researches. So let's go into this. Quantitative. It tests hypothesis, establishes fact, it shows relationship, it make predictions or statistically describe the situation. So these are the main things we see. What are the reasons for quantitative? It's either we want to test hypothesis, we want to establish a certain fact, we want to show relationship between two things or more, we want to make predictions, or we want to statistically describe a particular situation. This is the reason for quantitative study. What of qualitative? It helps us to develop grounded theory. So like I said, one of the methods of quantitative research is actually grounded theory. Currently, we are now going to talk about this. Our major focus will be on quantitative. So when we come to qualitative, we are going to explain to you what are they grounding in grounded theory. Is it grinding or grounding? So we see how we can explain this to ourselves. It helps us to develop understanding of a new concept, mostly things that we don't know them. We don't know their basis. And we want to start to understand the basis of those things. To get into the root, we go with qualitative. And with time, we'll be talking about developing understanding in qualitative study. It helps us to describe multiple realities. We look at things in different perspectives and we explain them. It helps us to do that. It captures naturally occurring behavior of a person or a group of people and all that. The deeper feelings, understanding, experiences of people can easily be captured when they are given a voice through qualitative study. These are some few things here we can say about that. So, what is the nature of the research design when it comes to quantitative and qualitative? And quantitative is highly structured, and it's usually formal, and it is very specific. It targets the main thing that it is meant for. Generally, qualitative studies are not properly structured. They are flexible, which means you can be going in this direction and quickly change your direction. But in the case of quantitative, when you say this is the direction you are going, you don't have any reason to change direction. But because of the flexibility of qualitative, you can be going in this direction, but you realize that going in that direction is not paying you or not giving you the result you're looking for. You switch and you change your direction, and it's still acceptable. Qualitative are often evolving, which means they can easily be altered. So because of the information that you have been generating, the more you generate information, the more you come up with a new idea. For example, one of the qualitative things we do in the clinic is that we do what we take patient history. So when we're taking patient history, you realize that you're asking a particular question and your major focus is that particular question. Tell me the onset of your pain. When did this pain start? And the patient, instead of telling you when the beginning of the pain, he started telling you how the pain started. There is a difference between when was the onset of the pain, and how did the pain commence? Actually, you see, this pain, if you know how it started, we went to the farm, and when we were coming back, I just twisted my leg. After twisting the leg, that is how this pain. Then you say, when was that? You can see that you've got one information which you are not looking for. Tell me precisely when it started. Then the patient may now say, oh, that is about 2 weeks ago. You see, you can see because of the flexibility of this particular whatever question. Okay, again, evolving. Now, can you tell me exactly what you stepped on that your leg got twisted? Did it enter into a hole? Or what actually is it that actually happened at that event? You did not intend primarily to look at those tiny things, but then because it came through what the patient is saying, you now feel that knowing those things may also add to your ability to understand the mechanism of the injury. And because you want to capture the mechanism, and the mechanism can guide you towards planning your treatment. You can see that because of the information coming or evolving, you are able to go into something different. So that's how qualitative studies are done. Again, participant when it comes to quantitative, many participants representative of the group from which they were choosing using probabilistic sampling techniques. So when it comes to quantitative study, we take a sample of the larger population. When we take this sample, it is that sample that we're going to use in conducting the study. You're trying to look at back pain in Enugu township. Now, because somebody told you, you probably realize that of recent, you've been having a number of cases of back pain in your clinic. And you decided to say, what is the incidence of back pain in Enugu? So in your trying to do that, would you go house to house to check how many people have back pain? Or you're going to take a sample of a particular region in, let's say part of Enugu, and say that I'm going to conduct this study here and extrapolate the findings into other areas in Enugu. So if the area you decided to examine can be considered, and the population you actually examine can be considered to be good enough to depict or explain the population in Enugu, then your findings can be extrapolated to a larger population, can be generalized to a larger population. So the target of a quantitative study is to take a sample that will be good enough to represent a larger population for the purpose of generalizability. So your target is for you to take a sample which is representative of a larger group, and later, generalize the findings of what you got from that sample to a larger population. So for you to do this, there must be a way to recruit subject. And the recruitment of subject is actually divided into two. Either you're using a probability sampling technique or you're using non-probability. But for generalizability, it is always advised that your sampling technique should be probabilistic. Now, probably people may not necessarily, not everybody may be able to key into understanding what are probability sampling techniques, what are non-probability sampling techniques. I think as we move forward, we may be able to go, I don't know whether I have it in this slide again. I think I have something like that somewhere. We may look at what are these sampling techniques and how are they used in sampling subjects. Okay, then qualitative. In qualitative, like I said, the target is not generalizability. Therefore, few participants are usually choosing using non-probabilistic sampling techniques for specific characteristics of interest to the researcher. In general, qualitative studies are conducted among a very few people, and that will be able to answer the question. So in the first place, let's say, for example, you're looking at pain expression during labor, and let's say, how do nurses in the labor ward describe how women in labor express their pain? How do nurses in the labor ward explain how women in labor express their pain or demonstrate pain? Somebody will say it's by shout, somebody will say it's by frowning, somebody is by being aggressive, and so on. So the question is, if I want to get the answer to this particular question, who are the people I'm supposed to recruit? Am I going to recruit female doctors? Am I going to recruit as patient? Or am I going to include every nurse that I know? Or I'm going to be very, very specific on the nurses that are particularly working in the labor ward? Looking at that question, since it is focusing on how nurses in the labor ward express how women demonstrate pain during labor, then it will be more appropriate for me to select nurses that are working in the labor ward for them to answer my question. You can see there is a specific selection bias, but not a negative bias this time around. It's not all biases that you look at that they are bad bias, but because we are being biased in the question that these are the people, this is the particular population we want to target to get information from, we have no reason to select any other person to participate in the study if not that particular population. So because of this, you can see it is the purpose or the intent of the research that determine the population we are going to recruit for the study. So in this particular case, the people that are qualified to answer our questions are nurses working in the labor ward based on the research question. And at the end of the day, they are the only ones we are going to recruit. We can't do otherwise. So for these, it is generally stated that for qualitative study, for you to recruit subject, you have to use a non-probabilistic sampling technique. And in particular, purposive sampling, which is also known as judgmental sampling, is the most important recommended methodology, sampling techniques for recruiting subject into qualitative study. This is just a little addition to, I believe those that are into this may actually understand this. So let's go. Data collection, and data analysis. How are they different in these two methods? In quantitative study, we focus on numerical data, which are collected at specific times from tests or surveys and analyzed statistically. This is majorly what we do in quantitative. So the data is characteristically numerical. Now, when it is not numerical, it is often converted to become numerical as well. For example, is male, female, are they numerical data? No, they are qualitative information. Being a male is a quality of a person. Being a female is a quality of a person. But then we can say how many men are involved. So we count 5 men are involved. How many female are there? 25 are involved. So what term is 5 is a numerical term. What term is 25 is a numerical term. So at the end of the day, we make a count, and that count representing a particular quality becomes a numerical data. So essentially, all data collected for quantitative study are numerical, while all data collected for quantitative study are essentially non-numerical. They are usually narrative data collected over a long period of time or short period of time, depending on the type of research, from observations and interviews, and analyzed using interpretive techniques. So we use statistical techniques in analyzing quantitative study, while we use interpretive technique to analyze data in qualitative study. So what is interpretive? Which means you interpret the findings based on the narrations that you get from subject or participant or respondents. Again, researcher's role. What is the role of the researcher in these two techniques? In quantitative study, we usually detach the researcher from the main study so that his biases will not reflect in the findings. So the researcher is often detached from the study, not necessarily being detached completely. We often say that in the outcome to be collected, we do not want this researcher to be the one to collect the outcome of the findings. For example, when we're trying to see the effectiveness of, let's say, an exercise approach in managing upper extremities, let's say elbow spasticity. So somebody came up with an exercise approach for managing upper elbow spasticity in the upper extremity. And he said this exercise technique is very effective, is a lot effective, or a lot more effective than previous techniques. So he embarked on this study. So when he wanted to assess whether there is improvement or not in the case of the amount of spasticity among his patient, he decided to collect the data, let's say using either Tardieu scale or using Ashworth scale. And he's the one that actually assesses the subject to see the level of spasticity. It is actually very possible that this person may be exaggerating the findings in terms of reduction in spasticity for those who did his own exercise, which means his bias towards the exercise is making him to indicate that patients who embark on his exercise have actually improved a lot. But then what we do, instead of him to collect the data, we say, why don't we blind the researcher in outcome assessment? So in that regard, it is now recommended that the researcher should not be the one to actually take the outcome. Instead, we now have a blinded outcome assessor. You'll be understanding this more clearly when we go to randomizations. So the outcome assessor is the one the assessor is blinded to the group that received the exercise and the group that did not receive the exercise. All the assessor is doing is he is just taking the data in terms of level of spasticity and he will present it. So we detach the main researcher from the outcome assessment so that his bias will not be reflecting or influencing the findings in the research. What happened in qualitative? In qualitative, the researcher, participant observer reporting participant perspective understood only after developing long-term close trusting relationship with participant. So the researcher have direct relationship with the finding here. He's the one that is going to do the interview, may not necessarily be the one to do the transcription, but then in interpreting findings, you need the researcher to be able to say, based on what I'm looking for, this is the explanation I'm getting. So you don't usually detach the researcher significantly from qualitative study. And that is why the quality, the findings in qualitative study are only applied with caution. And that is the reason why we do not even generalize their findings. Again, what of the context? The context of application, quantitative are usually, we need manipulation of, let's say, group, either group or intervention and all that. This may be understood when we go to aspect of, you may actually understand this better when we come to talk about, let's say, variables. What are variables? What are the different type of variable where we talk about independent, dependent variables? So what do we mean by manipulation of, what do you call it? Intervention and all that. You'll be able to understand that one better. Then qualitative is actually naturalistic, which means the setting is the natural setting and the explanation you are getting is original from the participant. So this is about types of research design, which we've mentioned. Under quantitative, we have the experimental and non-experimental divided into two. And under it, we have, under non-experimental, we have descriptive, we have comparative, we have correlational, we have causal comparative, which we'll be explaining in due course. Experimental could be actually true experimental, it could be quasi-experimental, it could be single subject experimental study. And what of qualitative? Qualitative is divided into case study, phenomenology, ethnography, grounded theory. We also have analytical study, which may involve the concept analysis, historical analysis, and we also have mixed method. So these are different forms of research designs. Our major focus actually is in this particular session is the quantitative study. So we may not say much about, aside from the explanation I've given earlier, we may not be discussing some other forms of researches. So quantitative designs. There are for two major categories: experimental, the investigation of causal effects through direct manipulation of an independent variable and control of extraneous variable. And the non-experimental, the investigation of the current state of a variable or the relationships other than causal between variables. I think let's move to the next slide. If the explanation is not there, I'm gonna come back to this. Okay. So the explanation is not there. Please, I need a break of 5 minutes break, please. I'll be back, just 5 minutes. Give me a 5 minutes break. I'll join you now.
All right.
Mahmoud. Okay, I'm back. So can we proceed? I'm back. Hello?
Yes, sir. We
Okay.
can.
Yes, you can proceed.
Yes. Like I said, this slide does not contain what I want to explain in the previous slide. So let me quickly go back to the previous slide. When we talk about quantitative study design, there are two major areas, which I've shown in the slide before this one, which is here. So we have experimental and non-experimental. The first thing we mentioned about quantitative is that they deal with numerical data, which means they deal with numbers. Numerical data explain dealing with number. I like going into elementary way of explaining things. So since they deal with number, and they say there is causal effect. When we say causal effect, something causing something to happen, something making something else to happen. For example, you saw two people fighting, and when you go there, you're not expected to just do, yes, definitely you try to separate them. But then one of the things that you would do after everything is for you to say, what actually causes this fight? Why are they fighting? What is the reason for the fight? So definitely you're going to ask that question. So which means you're trying to find out what leads to the fight, what actually push them to fight each other. So in experimental study, we are interested in what is making what is making B to happen. What is the origin of this thing? What causes it to happen? So that is what we mean by causal effect. That's exactly what we mean by causal effect. What makes this to happen? Now, again, in experimental study, we believe that there is need for you to introduce something to get a new thing. For example, you say some people came to your clinic and they were sent for treatment, and these people happen to be diabetic. Now, what are the things that you would do as a clinician to help these people? You may say, since they came with diabetes, which is high blood pressure, blood sugar, you wanted to reduce the level of blood sugar. And what are the things that you have that will cause the reduction of blood sugar? What do you have that will cause the reduction of blood sugar? Assuming it is smiling, that when people smile very well, they will actually have reduction in their blood sugar. So you now have a situation where you now sit all of them down and say, oh yeah, you have to create a way to make them smile. So at the end of the day, when they have reduction in blood sugar, you will be asked, what did you do that make them have reduction in blood sugar? You will say, I make them go through the exercise I call smiling exercise. And the effect or the outcome of the smile is reduction in blood sugar. So what causes reduction in blood sugar? Smiling. So now, do you have a group? How do we know whether smiling has actually contributed? You probably have a group that you ask to smile, and you have a group that you say, keep doing what you have been doing before. For example, you've been taking insulin, keep taking your insulin. But my own group, I asked them to keep taking your insulin and add smiling to it. And we see that people who added smiling to the insulin they've been taking, they actually have reduction in blood sugar. So at the end of the day, would we say you have actually manipulated the situation? Yes, you did, because you introduce what is not there, and the effect is reduction in blood sugar level. So this is a small example. We're going to be looking at a deeper example when we go to the next page. Let's go to the next page. An example of an experimental design. Everybody can try to, please write as I explain this. You can get a pen and write so that you can understand this a lot clearer. So number one, they say you should randomly assign undergraduate student to one of two groups. So what you're going to do for me is pick a pen, pick a paper, and say you have two groups. Number one group, call it A. Number two group, call it B. Number one group, call it A. Number two group, call it B. I hope you've been able to do that now. If you don't have a pen, I can give you 1-2 minutes to get a piece of paper and get this done. I'm chilling for the next 1 to 2 minutes just for people to get paper and a pen. So we continue in 12:40. And if you have your paper and pen, and there is no way I can confirm whether everybody has it. So the 2 minutes is, I think, is better. Okay, I think we can proceed now. So, randomly assign undergraduate physiotherapy student to one of two groups. I say you should get a piece of paper, write A group and B group. So, in which the same aerobic exercise is trained to improve cardiorespiratory endurance. Understand this, we say in which the same aerobic exercise, which means the two groups are going to go through the same aerobic exercise. So it's trained to improve cardiorespiratory endurance in the two groups. So number one, teach the first group using the traditional non-instrumental exercise approach. Now, what we say is that you use the normal method, which is here, there is no any instrument that will be used. Group A are going to go through exercise without instrument. You can say group A, exercise without instrument. Write it under what you write on group A. And the second group using contemporary instrumental exercise approach. Write group B, you say exercise instrumental exercise group. You understand? Now, what you're going to do is examine the achievement or differences between the two groups to see if the type of approach, whether you use an instrumental or non-instrumental approach to cardiovascular injury had an effect. So you want to see whether those people who use instrument and those who did not use instrument, whether who among them actually improved better. So your target is, does using instrument, is it better than using no instrument? Now, what I want you to understand in this explanation is that you've actually manipulated the group. Manipulation is that assigning them to different groups is the manipulation here. Making them to go through different experiences is the manipulation here. I hope that is clear. This study is characterized by the investigation of cause. What is the cause now? What are you causing? Aerobic exercise approach is the cause. And what do you want to see at the end of the exercise or of the course is cardiorespiratory endurance. Who among the group has improved in cardiorespiratory endurance? Manipulation, choice of approach. You can see, I told you, choice of approach, whether instrumental or non-instrumental. And control, we now have control group. Same unit of exercise being taught randomly as random assignment into different groups. You understand? So you can see we have, so in every study that you are given, you should be able to say, what is the investigation? What is the cause? What is it that you are introducing? What are you introducing? Which is the cause now? What are you trying to get? Which is the effect? What is the manipulation? Talking about the groups you have in terms of doing different things. That is the manipulation. You can have 2, you can have 3, you can have as much as you want. The manipulation. And what are you controlling for? The type of exercise each group is going through, or the type of investigation, or the type of intervention you are introducing to each group. Those are the control. So, quantitative designs. Differentiating the 3 types of experimental designs, we have what we call true experimental design. What is a true experimental design? When we say a true experimental design, it is an experimental design where you have an intervention group and you have a control group. But the 2 groups, subjects are assigned into these groups randomly. They are not specifically chosen and say that you are in the control group, you are in the experimental group, or you are in the intervention group. To get into a group, it is by random assignment of subjects to groups. So, what makes it true is because 2 major things are the things we look at when we say true experimental. Number 1 is that there is a control and there is an intervention. And when we talk about intervention and control, we are not referring to just 2. You could have 1 control group and multiple interventions. For example, for somebody who, in the last experiment we did, we said we have a group A that is doing traditional exercise without instrument, and we have a group B that is doing instrumental exercise. Now, in this instrumental exercise, we can decide to say that we have different form of instrumental exercise. For example, the use of ergometer, bicycle ergometer, the use of treadmill, right? The use of rowers, and many other forms of instrument that we can use to make people to exercise. So if we have these different groups, we can say we are comparing the traditional approach to all these intervention groups. Which of the intervention is better than using traditional method? It's possible that when you finish your experiment, those people who go through bicycle ergometer are not even better than using traditional approach. Or it is even treadmill that is not doing well. People who go through ergometer, they are even better. But your head may be telling you that treadmill may even be better. But remember, treadmill, in the case of ergometer, all the joints in the lower extremity are participatory. What if because of this, because of the fact that a number of joints are involved in the exercise, that is why bicycle ergometer is better than the rest. So all this is not possible for you to understand until you go into experimentation. So this is one area that I want you to understand. So in true experimental study, you have a control group and you have an intervention group. And the second most important thing is that subjects are assigned into groups at random. If they are not assigned into groups at random, it is also not a true experimental study. I hope this is also clear. So I want people to understand what they mean by true experimental study. Like I said, there are two major characteristics that we assign to it. Number one is that subjects, there is a control and there is an intervention. That is number one. Number two is that subjects are assigned at random. So you hold on to these two. So what is quasi-experimental study? Somebody say quasi, somebody say, but depending on the way you pronounce it. At least if you get the spelling right, I don't care about after all, English no be my papa language. So let's go on. In quasi-experimental is a research approach that, like a true experiment, it's like a true experimental study. It's trying to establish cause and effect, but it lacks random assignment of participants to groups, often due to practical or ethical constraint. So in quasi-experimental study, the major problem is that participants are not randomly assigned to different groups. So there could be subjects in this group and there are two groups, but the major problem is that participants are not assigned into groups at random. So if a study is conducted and there are two groups, some participants were just asked to be in this group, while some participants are going to be in the other group. We compare the outcomes of the two groups, but the major problem we have with this is that there is no random assignment of subjects into groups. I hope this is clear.
Yes, of course.
Yeah. So then we have what we call single subject. In a single subject, non-random selection of single subject. In single subject, the main thing here is it is a single subject that is exposed to an experiment. So how do we check whether there is what do you call it? There is an improvement. In this case, usually what we do is to check pre and post. Pre and post. So the design evaluates intervention effect on a single participant or a small group. It focuses on repeated measures and visual analysis of subject, of outcome. What do we mean by that? If, for example, I actually have, I wanted to see the effect of, let's say, an exercise on performance of student in school. On performance of student in school. Let's say they don't have extracurricular activity in the school. So I decided to introduce exercise. So now, and because all the students will be interested in exercise. So instead of me to say that I will have a group that is not doing an exercise and a group that is doing exercise, I just decided to say that, let me check their performance now before introducing the exercise. So I take the record of all the performance of the student and I documented it. Then I introduced my exercise and the student started exercising. It could be for 1 day, it could be for 1 week, it could be for 1 month, it could be for the whole time that I have 2 days or 3 days that I selected that these 3 days, student must go and exercise. It could be football, it could be anything. So after they finish this period of exercise, they wrote another exam and we decided to compare their exam, the exam they wrote before we introduced the exercise. and the exam they are writing, they wrote after we introduced the exercise. We now make comparison between the first and the second, that is the baseline and the outcome. And the result is telling us whether the student did not improve, whether they actually improve. If the result of exercise, the result after introducing exercise is better than the result before introducing exercise, definitely that will give us confidence that our exercise have actually done a lot of wonders. So, and many other form of example could exist in this regard. I hope we are following this. Okay, quantitative designs. Now let's look at non-experimental designs. We did a study, and the name, the title of the study is Passive Social Support and Social Constraint in Hausa Women Who Suffered Stroke, or Hausa Women Stroke Survivors. It is a cross-sectional study. Now, this is another thing. One of the designs that is non-experimental is actually what they call what is cross-sectional study. Like I said, in our second session, we are going to go deep into understanding different form of research designs, inshallah. So, number one, these are the findings of that particular research. The research indicates that the majority of participants, that 60.8%, reported adequate level of social support. Most participants reported fairly low level of social constraint. Remember, the study is looking at social support as well as social constraint. So they indicated, a good number of them indicated that they are well supported by their family members. So most participants reported fairly low level of social constraint. So the challenges they have in terms of social constraint is massively very low. You understand? So even though the social support, you'll be thinking that the social support should be close to the lower level of social constraint. You should not be, the people should be able to express the level at which they are supported. They are not, it's not as, they have, the support has actually reduced the level of the constraint, which means suppose is contributing to reduction in level of constraint. None of the participants' socio-demographic features had significant relationship with either social support or social constraint. So we look at the gender, we look at the occupation, we look at many other factors, and we realize that none of them is even making the level of social support better. Findings indicated an inverse relationship between social support and social constraint. So the higher the support, the lower is the constraint, just like I said. So now this is a cross-sectional study, and we gave you the findings. The thing is, do we even understand what is cross-sectional study for us to be able to interpret this finding? So we'll be explaining what is a cross-sectional study. Then probably after it, some of you can come back to this slide and understand why the study is like this. But for now, this is the finding of that study. But essentially, what is cross-sectional study? A cross-sectional study is a study where observation is made in a single time point. You want to make an instant observation about something and bring out the findings. That is what we do in cross-sectional study. We look at a group of people and make a particular observation about something. Let's say, for example, the level at which a society, your own society, was scared when the COVID-19 incident was ongoing. To what level, to what extent are your people disturbed or scared or worried? So you want to assess that level. Now, if it's not something that you have to wait for a long time, you just collect data. Are women more disturbed? Are men more disturbed? Are younger ones more disturbed? What is the way at which it affected the psyche of the people and so on? So within a short time, you can take this data. That data that we take in this form, or researches that we take in this form, are what we call cross-sectional studies. Okay. Differentiating the 4 types of non-experimental study, descriptive, comparative, correlational, and ex post facto. We'll be talking about ex post facto research design as well. And I want to draw a curtain to the presentation now. I have to go for prayers. We can reconvene by 2, and I mean 2 exactly, for us to continue. I will take 1 or 2 to 3 questions, if any, on what we have discussed so far, before I close this session. Any question? You can type in your question, you can send in your question, whichever way you want it. I will be attending to it. Any question? Is there any question? If there are no questions, I will be closing the session for now. Then we reconvene by 2. I think somebody sent something. Somebody says, so patient know about shortwave. It's a bit confusing there. I don't think I say patient know about shortwave. I say the student is the one talking about shortwave. That I gave an example regarding use of infrared tunnel bath shortwave cryotherapy. So I'm not referring to patient, I'm referring to the students. Regarding the slide, the organizers will share the slide with you. Yeah, regarding cross-sectional study, I've not given enough explanation yet, probably in the next session. So we'll be, thank you, Mr. Folajimi, for the, commendation. So cross-sectional study, I think we're going to be talking about it more deeper when we return. Thank you all. See you by 2. Bye.
Thank you. See you by 2.
Yeah.
Right. See you by 2.
Okay, welcome back, everyone. Welcome back. Are we ready? Hello?
Yes, we are
Are we
ready,
back?
sir.
Yes, sir. Yes, sir.
Are we back? Can we continue?
We are ready.
Can we continue?
Yes,
sir.
we can.
All right. Thank you. Sorry for the short delay. Was having some technical problems. Okay. I think we'll proceed from where we stopped, which has to do with cross-sectional design. I added some few slides for explanatory reasons, so we're going to move a little backward to tackle issue around cross-sectional studies. In the first place, I want you to understand that we've already stated that divisions of quantitative studies. One of it is actually the descriptive design, so descriptive study design. And one of the designs under descriptive is actually cross-sectional study. So we're going to be looking at that. So descriptive research is undertaken to describe answers to questions of who, what, where, when, and how. And what do we mean by that? When we say who, we are essentially referring to a category of people or a person that we are interested in conducting a study on. So it's majorly focused on describing a population. The who question in a research is majorly describing a population, or let's say group of subjects that the researcher is conducting a research on. Then the what in a research is focused on the study interest. That's, for example, what about the population? What about the subject? What about the disease condition? And so on. So that's what the question what actually focuses on. So when you go back to research questions, so anywhere you have a research question that is talking about the who's, it's either talking about an individual as a subject, talking about a group as a group of subjects, or talking about the entire population. So the what is actually focusing on the outcome. It's essentially focusing on the outcome of the research. So therefore, research question can be population-based, which is all subject-based. Research question can be outcome-based research question. Then where it can actually be the setting, that's where the study is being conducted, the area, the location, the place, the country, the economy. I mean, talking about either low-income countries, high-income countries, and all that. So where is describing a setting where the study is being conducted. When is actually describing the time. There could be a research question that is focused on the time. We can, for example, talk about, I mentioned a lot of things about the pregnancy, and I was like, talking when I say something about labor, assuming that we conducted a study to look at the effect of exercise on labor, we may be interested in knowing duration of labor. How is it altered? How is it affected by the type of exercise we introduced? So that is about when. Issues related to duration, issues related to time, and so on. But the how in a research question is basically focusing on methodological approach. Methodological approach. How is it done? How do we perform it? How do we conduct it? How is this being carried out? So your research question can actually be a population base, an outcome base, a location or setting base, or time based, or methodologically based. So you can have all these variation of research questions. It is desirable when we wish to project a study findings to a larger population if the study sample is representative. We've actually talked about a lot about this when we're talking about generalizability of research findings. Now, descriptive research design or classifications could actually be two types: cross-sectional studies and longitudinal. Like I said earlier, cross-sectional studies are conducted at once. They are majorly timed period. It can be from this time to this time, but essentially they are not of longer duration. We are not monitoring change when we do cross-sectional study. We are not essentially focusing on whether a change has happened. We are reporting situation. We are focusing on situation of something at a particular time period. Somebody sent a brief question that, can it be periodic? Can it be centered on period? Yes, it can be centered on period, but you are essentially reporting situation within a period, but you're not looking at changes within a period. Often when we can have a brief of changes, but they could be natural change, but not experimental change, not because we have a cause and effect. But when we talk about longitudinal studies, they are also they could be naturalistic, which means they can be they are the ones that often focus on situational change. They are not necessarily experiment, but they are looking at situational change. Let's say from the period of COVID, which is 2020, we have a lot of economic challenges. Let's say in low-income countries, Nigeria inclusive. Now, how has the impact of COVID transformed the economic situation in a third world country? You can see that the period of COVID, so this time, and you started monitoring the trend of changes. You start monitoring the trend of changes. So it could largely be a form of longitudinal observation of the changes. But when it is a short-term, when it is usually short-term, it's considered to be essentially cross-sectional. You may read more about cross-sectional studies. It's a simple approach. It's easy to understand, but probably this lecture may not offer you everything you need. But then you can send me questions privately or here on what you want to get clearly about longitudinal cross-sectional studies. But a number of longitudinal studies are actually experimental studies as well, because we put an intervention and we want to see how long it would take. Some longitudinal studies are basically prospective studies and so on. So you may send some few questions if you have in areas where you don't understand. Cross-sectional studies measure units from a sample of the population at only one point in a time. So it's a snapshot. So as a
Okay. Kwana biyu na kan wani lokacin sai wajen tara ma sannan sai ne tunanin ma ana saba mun sabani ana ƙara lafiya. Assalamu alaikum.
Please, we can't hear anything.
You can't hear me. Is the slide visible? Can you hear me?
Yes, sir.
Okay. Do I need to go back, or is it? Do I need to go back, or is it okay? I continue from here.
Go back, sir.
Okay. Okay. I talked about cross-sectional studies, and I say we conduct it at only one point in a time. Is a form of a snapshot. You just conduct it within a specified period that you specify that you're going to conduct the study. Let me give you a quick example. Suppose a postgraduate student actually decided that what I look at is that it seems like generally low back pain or knee osteoarthritis is commoner among those that are aged. Let's say from the age of 65 and above, they are the ones that suffer knee osteoarthritis, though the age is declining. Let's even say from 65 and above. And I hardly see my patient that are below 55 having knee osteoarthritis. Suppose that is the observation of the postgraduate student. And for this reason, the student decided that he wanted to conduct a study that is there a reason why we are going to have these type of problems as somebody ages? Yes, the literature is very rich when it comes to age and osteoarthritis of the knee. But then this individual have a feeling that, can this be because of changes in the knee mobility as somebody ages? For example, is the range of motion or range of movement of the knee joint, does it change as we get older, or is it actually the same? So this individual now decided that I want to examine changes in the mobility of the knee as age increases. So he recruited subject. For you, A quick one for everybody now. Can we try this assignment? Just write your own explanatory note. If somebody is to conduct a study, he is going to conduct a study and he wanted to see the changes that are happening in the mobility of the knee as individual get older. As the individual gets older, that is from the age, let's say he's decided to start from the age of 5. So when you assess the knee, the range of motion of the knee at the age of 5. So when the children or when the individuals become 10 years old, he wanted to check the knee range of motion again. When they become 15, he wants to check the range. When they become 20, and on and on and on. So at the end of the day, he wanted to compare. Is the knee range of motion, is it actually decreasing as the individuals are getting older? Or it remains the same? So if he is going to conduct this research, would you suggest that he get children that are at the age of 5 and start monitoring them until they become 65 or even above, so that at every 5 years they added, he is going to check the range of motion of the knee? Or what actually are you going to suggest for that individual? Write your answers. Write your answers. I'm giving 2 minutes for this. And if you want more explanation, you can ask me to explain it again for you to respond. If the explanation is okay, please write your answers. What would you suggest for the student to do? So first answer is coming in from Chidera. I've seen your answer. I'm going to talk about this. Okay, Mr. Nelson, I've seen your own. Jidda Zainab, I've seen your own. Gloria. Okay, I've seen what Gloria wrote. Yeah, I've seen what Akin Sholu writes. Peter, I would suggest the student uses the same patient if he's sure living that long. Okay, that's interesting. Regina, okay, what do you have? Okay, you can take individual measurement at 5 years interval or take different individuals to, okay, and do measurement. I would suggest that the student should use the same participant throughout the study to monitor the ROM. I think this is an observational study. Beautiful. Okay, that's Olua Tosin. Good. Take data from each category of year and measure their range of motion, then compare. Okay, that's from Paula Jimmy. Okay, and who do I have again? Udwork actually has, I would ask the student to rely on past studies more, work with individuals of different age range. He can monitor within 3 years of his research. Okay, Yeah, so we're gonna stop here, and thank you very much for your responses. And I think I like the so let me look at, I will respond by individuals. Shidera Excellence, I would suggest the student get different age groups. So your answer is correct, correct answer. Good. Nelson, he will get individuals of different age category, correct. Is the same thing with Shidera, same answer. Take from each age category of year and measure there, correct. Jidda, you're correct. Gloria, cross-sectional. The answer is actually cross-sectional, but your explanation is not clear. You would have gone beyond saying it's cross-sectional. I would suggest the student uses the same. Now, Akinsholu, how is he going to be sure about that? So you're right, but conducting it longitudinally would be completely impossible. Yes. He can take, Regina says he can take individual measurement at 5 years interval or take different individual to different. Okay, this is a bit confusing, but I think I got what you're saying. He may decide to go longitudinal or cross-sectional. So cross-sectional is actually the answer, not longitudinal. I would suggest that the students should use the same participant throughout. Woo, woo, woo. How is that possible? I would think this is an observational. Yeah, it's a cross-sectional observation, but then it's not possible to monitor the same subject for that duration. It's going to be completely impossible, Mr. Oluwatosin. Take data from each category of year and measure their range of motion, then compare. Yes, but how is he going to take the data? You basically, you need to be very straightforward. You should get sections of age group and take data from each category of age group and make comparison. Mr. Fola Jimmy, Duak, Afe Lumo, I will ask the student to rely on past studies. You can't go retrospective for a study like this. It has to be a prospective study, but then of shorter duration, like cross-sectional. So the answer is not correct. Whereof, hello, Ruben, he will select different age groups, correct, from 5 years of age to 65 years of age and compare its. No, it can't be longitudinal. It's actually a cross-sectional study, Mr. Ruben. Thank you very much for your responses. So a quick answer to that, which is going to align with most of what I'm very impressed with the answers. More than 60% have it correct. It is a cross-sectional study that can only be conducted for a short time. The student is supposed to get different age categories, probably classifying them and say from the age of 5 to the age of, let's say 15, 10 or whatever, and from the age of 20 to the age of these, from the age of this to the age of these, and check out the knee range of motion across these age categories and make comparison between the group of ages and conclude on what he's able to find. And this can be done. This is more realistic than monitoring it longitudinally. Suppose he recruited, remember I told you the student is a postgraduate student. Suppose he recruited student of a minimum of age for postgraduate studies in Nigeria cannot be less than 21 or let's say 22. So for those who graduated at the age of 18, if that is possible in physiotherapy, now he must have done his service for 1 year and probably proceeded for NYSC for another year, making him 20 years of age. And by the time he's coming back from master's, he's 21. So that's why I say 21 is the youngest age of starting postgraduate studies, particularly master's degree in Nigeria in physiotherapy. So if he's 21 and he's recruiting people at the age of 5, and he will keep monitoring these people. When they are 10, he will now measure. By that time, how old would he be? He's going to be 26. So when they turn 15, you add 5 to his 8 is going to be 31, right? When they turn 20, it's going to be 36. When they turn 25, it's going to be 41. And we are expecting him to continue to monitor these people until they are at the age of 65. How realistic is that? Is completely unrealistic. So that's why going cross-sectionally will be the best way to approach this study. I hope that is clear. So you can see one of the advantages of cross-sectional study is that it can be done within a short time, and you have an answer that will be given to you by longitudinal study, which is going to take a longer duration. And it is more realistic, more feasible, more economically viable, and so on. So that's that about cross-sectional study. These studies are usually presented with, okay, don't worry about that. Okay. Okay, where are we now? What's going on? Okay, longitudinal studies repeatedly measure the same sample unit of a population over a long period of time. Since they involve multiple measurements over time, they are often described as movies of a population. So you see, it's like you are covering a movie. Monitoring somebody for that long duration is like completely like a movie. There are studies that definitely the best way to do them is longitudinal approach. But most of the population studies are done cross-sectionally. So in descriptive study, we could have a continuous panel, ask panel members the same questions on each panel measurement. We can also have discontinuous panels, vary question from one panel measurement to the next. These are sometimes referred to as omnibus panels. Omnibus meaning including or covering many things or classes. I'm going to give you an example with that. You see, I don't know whether some of you have come across what we call Delphi study. Delphi is spelled as D-E-L-P-H-I, Delphi study. In Delphi study, we usually try to have a consensus about something we are trying to create. Let's say currently there is no guideline for exercise implementation in persons with diabetes in Nigeria. We do not have any document describing how exercise should be conducted among people with their diabetes in Nigeria. There is no such document. It doesn't exist anywhere. Now, assuming somebody just decided that, but why are we going to be doing something blindly? That we are asking people to do exercises and there is nothing guiding us. So he now said, I'm going to come up with a guideline for management of diabetes using exercise. So who is he as an individual to say that this is the guideline I'm writing and everybody should accept it? Even if he's a professor of diabetes, he cannot write that rubbish. Nobody is going to accept it from him. Your being professor of diabetes does not make you completely an authority that you dictate to people and say that without any evidence to say that this is the reason why I say you guys should continue to use this. No. We need a group of people that will accept what you are suggesting as a form of exercise for people with diabetes. It is necessary for us to have such kind of agreement. So we will need to contact experts from everywhere possible to look at what your suggestion is, make observation about the suggestions, write and criticize your suggestions, correct some of the areas that you got it wrong, and accept some of the areas that you got it right. And after their own observations and whatever they have suggested that, no, take out this, remove this, add this, and whatever, you are going to come out with a consensus of those experts and present it as a guideline based on expert consensus. Even though you are the author, but the main reason why this is coming out is because experts in the field have agreed that this suggestion you are bringing, and they've made contribution to the final document before that thing will be accepted. So the people that you are going to pull together as experts, we call them panel members. So, and these panel members, when they are made up of different fields, for example, to manage diabetes, are we only looking at physicians, or we are looking at different experts? For example, we needed endocrinologists. True or false? We needed physiotherapists. We needed occupational therapists. We needed cardiologists and a host of other specialists to be involved in coming up with, they all have a role to play in managing diabetes. So if you write, for example, and you say that the patient should be having, after every exercise, he should actually have a spoon of sugar to make sure that his sugar level does not decline. You add it as part of your suggestion. Otherwise, if the sugar level decline, the patient may go into coma, assuming you write it as part of your explanation. And an endocrinologist just look at it and say that, no, for an exercise to be able to bring depletion in sugar level, it must have reached this level of influence on the sugar. Otherwise, there is no need for us to ask the patient to take 1 spoon of sugar. So therefore, your excuse of saying that because you don't want the sugar level to decline, therefore patient should take this amount of sugar, may not work, and therefore remove it as part of your suggestion. Then you have to remove, because there's an expert that is giving a scientific evidence to tell you that what you suggested is not right. So these panel members, often that we pull together to do this, they are usually the omnibus panel, because they cover many things or classes. So usually they are involved in this continuous panel. So the panel will work from so-so time to so-so time. After they return their answers to you, you look at it, you correct the area, you return it back to the panel. You see, it is not continuously, so you go back again. They now look at the new document that you are presenting, that has removed what they asked you to remove, that have added what you asked them to add, that has explained certain things that they did not understand in the document that they asked you to explain. Then you now add those information and send it back to them. They review it again. Where they are satisfied, they say they are satisfied. Where they are not satisfied, they say they are not satisfied. Then again, you come back, you correct it again. You send it back to the panel. If they are now satisfied, you now come up with the final document and say that, based on expert consensus, this is the guideline for the management of diabetes using exercise in Nigerian setting. So you see, it is only in descriptive study that you have this kind of situation. No experiment can do that for you. It is after this exercise procedure suggested by expert and pulled together by you that you will now decide and say that, can I test this new exercise design? You can now go into using it in an experimental study. But the first stage of coming up, of formulating the idea or coming up with the guideline, has to go through expert consensus. And that is also a descriptive study design. So we say discontinuous panels are demographically matched to some larger entity, implying representativeness. So they represent panels demographically, that is in terms of their knowledge, and or they could actually be, all of them could be health practitioners. They may, when we say demographic matching, does not mean in every aspect of what we are saying. For example, all of them must have PhDs. No, provided they are practicing and they are managing diabetes and they are healthcare professional, they can be matched, physician can be matched with a dietitian and so on. Discontinuous panels represent sources of information that may be quickly accessed for a wide variety of purposes. These are just additional explanation. Now, going by what we have described, now if you go through this result, you may be able to understand it better that the researcher actually conducted a cross-sectional study, and what they did in the research is to go into the society where there are women that suffer stroke, and all of them are Hausa women. And they decided to find out what are the type of support they have in the society they lived in, and what are the social constraints and social challenges they are facing in such society. And in this case, they pulled together women that suffer stroke and are of Hausa descent, and they started asking them questions about social support. They gave them questionnaire, and these people answered the questionnaire. And they also gave them questionnaire regarding social constraint, and the people answered the, whatever. So the main thing here for us to understand that is a cross-sectional study is that it is one conducted at a single time point, and the focus is about specific interest, which is later portrayed in the findings of the study. Like I said, they have majority of them are these, and that, and I think you can go through this, and I believe you will understand it better. Differentiating the 4 types of non-experimental. So we've actually talked about descriptive study. It makes careful description of the current situation or status of a variable of interest. For example, in the previous study we talked about, it tells us the current situation of social support, the current situation of social constraints of the Hausa women in the society. So it's a descriptive study. Comparative compares 2 or more groups or some variable of interest. We could actually say that we are doing a descriptive study, but it is a comparative descriptive study. How can we compare a descriptive study? For example, when we say we are looking at social constraint and social support here in this study, can we actually make this comparison in terms of who among the rich and the poor have better social support? Did we conduct any experiment to do that? No. Who among them has more social constraint? Is it the poor or the rich? So it is still a descriptive study, but it is making a comparison in this case. And it does not make it to become an experimental study. It is still a non-experimental study. It establishes relationship, e.g., non-causal. It's trying to say what is the relationship between this and this, between or among variables. It can make comparison. For example, what is the relationship between social support and social constraint? If you go back to the study we mentioned there, we said none of the participants' social demographic had a significant relationship with either social support or social constraint. So there is no relationship between age of an individual and the likelihood of that individual having more social support. For example, because you are older and you have stroke and you are a woman, it doesn't mean you are going to have more support than somebody who is younger. Your support and their support is literally the same. So there is no significant relationship between how old an individual is and the level of social support that is offered to that individual, provided the individual is a woman and provided the individual suffers stroke. They have literally about the same level of, there is no age relationship in a social. And the constraint, the challenges they have, whether they are old or they are young, age is not actually having significant relationship with the amount or the level of constraint that a woman depicts when she suffers stroke among women of Hausa descent. Explores possible causes and effects among variables that cannot be manipulated by the researcher. So to some extent, there is chances of you trying to see causes of something, but not in an experimental way, and seeing the effect of something, but also not an experimental way. So you are like a suggestive form of cause, suggestive form of effect. You are looking at the influence, the chances of having this because of this, but then not in an experimental manner. So some common clinical quantitative research designs. In this case, I'll give you just like 5 minutes to I'm going to set some few questions and people should start answering the questions. I'll be asking the question and you send in your answer before we move into this session, because this one is more demanding and a little bit more challenging. So let me ask these questions. You write your answer immediately and post it. PICO, as discussed in previously, stands for what? You have 1 minute to answer that. PICO, as discussed earlier, stands for what? Quickly answer it. PICO, P-I-C-O, stands for what? Quickly answer that. I'm waiting for answers. Quickly answer that. PICO stands for what? PICO stands for what? Good. Okay, second question. Where do we use PICO? 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 Second question, where do we use PICO? Where do we use PICO? When do we use PICO? When do we use PICO? Keep sending the answers. Good. Good. So the clear answer is that PICO, everybody got what is PICO, which is a significant number of people who send about PICO were able to state what PICO as an acronym, what does it stand for? People were able to give the answers correctly. When do we use PICO? Those who say experimental study, they are very correct. They are right. We use it in experimental studies more than in other form of study. Then it is also used to formulate research questions, which is also correct. This is also correct. Thank you. That's good. Now, in finger, the N in finger stands for what? 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 I would have preferred you are using adjective to answer the question. You are correct, but then you would have put it in a form of adjective. So if you use the word novelty, would have been better than saying novel. It's basically novelty, right? Good. Okay. N is not feasible, please. It does not stand for feasible. Ransom. It stands for novelty. Beautiful. Now, define cost effectiveness. 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 Please don't use Google. Just use your personal understanding and send answers. Don't use AI. Don't use Google. Be very sincere. Just say it in your own words. Okay. Somebody, Zainab said finance needed for the research. That's a partial answer. That's a partial answer. Zainab, we'll be explaining it more. What is cost effectiveness? Cost effectiveness. Good answer, Zainab, but it goes beyond that. The actual cost of carrying out a research, Regina, it goes beyond that. It's correct, but it goes beyond that. Wow, beautiful. Yahya Hassan Abdu, this is excellent. Yes. Yes, cost implication ransom is correct, but it goes beyond that. Beautiful, Francis, good. Gloria, this is not clear. Can you be a bit more explanatory? The cost of research outcome should not be more expensive than what already exists, what is already existing. Good, good. The best way of doing a research using the resources available effectively. Yeah, somehow, not necessarily. Cost implication of carrying out a research, not necessarily that. So thank you very much, everyone, regarding this. I'm going to explain it. When we say cost effectiveness, we are actually referring to trying to make sure that you achieve your desired goal of conducting a research using minimal resources that does not go beyond what is already existing. If something is, and again, not just about money, including time and any other form of resources, should always make sure that this is done within a framework of time, money, and other resources, which is at a lower level compared to what is already existing. So that's what we mean by cost effectiveness. Okay, I think we should come up with the last answer. Last question. So if you can write this, I will be saying it. I'm not dictating from anywhere. This is coming from my head. And it's typical of me for my student who knows me very well. So write this down, please. Mr. Ruben. I'll be typing it somewhere so that I'll be able to repeat it. Mr. Ruben is a final year physiotherapy, is a postgraduate physiotherapy student. Mr. Ruben is a postgraduate physiotherapy student trying to specialize in cardiopulmonary physiotherapy. Trying to specialize in cardiopulmonary physiotherapy. Suppose he came up with a topic. Titled Development of development of a model exercise. Development of a model exercise development of a model exercise to reduce respiratory challenges. Among children living in cement industrial area at Obajana, Kogi State. Among children living in cement industrial area at Obajana, Kogi State. Who has written the question so that he can post it for everybody to see? Who has written the question so that he can post it for everybody to see? Am I audible? Hello, everyone.
Yes, sir.
Am I audible? I'm audible, right? Who has written the question? Okay, so that we can see the question here. And please share it to public, not to me only, so that they can all see it. Probably this is the first time you are having a theory form of whatever that is practical, cool? Okay. He came up with a topic titled Development of a Model Exercise to Reduce Respiratory Challenges Among Children Living in Cement Industrial Area at Obajana, Kogi State. Full stop. Question 1. In your opinion, what are the 2 research questions the student will focus on? Or let's say write 1 research question the student will focus on. Write 1 research question the student will focus on. Number 2, what method research design would he use to develop the model exercise? What research design would he use to develop the model exercise? Number 3, how would he test the effectiveness of the model exercise he developed? How would he test the model exercise he developed? So please post the questions that I just mentioned. I can't remember them. I'm telling you, I'm just coming up with it now. So post it so that people can see that one as well. Then I'm giving you 5 minutes. People should answer that question as well before we proceed. Okay, I guess somebody has helped us with the question. In your opinion, write one research question the student will focus on. What research design will he use to develop the research design? How will he test the model? So go on. I'm waiting for your answers. Send in your answers. Let the answers start coming. I'm waiting. This is not difficult. If the answers can now come, let me know so that you now know these are the challenges that we have. Then we explain this question. Then we can proceed. So I'll be observing your questions as you send them in. Is there environmental influence on rest? So the first question you're supposed to answer is, what is the research question? What is the research question? That should be your first whatever. No, what is the effectiveness of exercise on improving respiratory function among children in cement industry area? Yeah, Mr. Hassan, you've gone beyond what is expected, because in the first place, why do we need to develop the model? What you are supposed to focus on is why do we need the model first? So that would be the first thing. Miss Method, Zainab, you're correct, but then I want the first answer before this one. What is the effectiveness? Yes, Ms. Hassan, like I said, we need more than that. Effect of exposure to cement on respiratory. This, like, more or less like you are creating your own topic, Mr. Nelson, and that's not what we're looking for. Will exposure to cement have effect on the respiratory function? Excellent, excellent. That, Mr. Nelson, I take your second one, not the effect of exercise. That one is a new topic you are creating. But the second one is more or less like a research question, which sounds very, very good. Will exposure to cement have effect on respiratory function of children living in cement industrial area of Obajana, which is correct. That's very good. That's very good. But we can get, what is the respiratory challenges of the participant? No. Zainab, you can do better than that. What is the impact of exercise? You've gone beyond what we are looking for. Chidera, you can do better than that. What causes reduced challenges among children? How many children are suffering from reduced? How he can test the effectiveness? Who is that? Regina, you've talked too much, and the impact is less. You would have taken it one by one. That will help you when you're answering questions. How many children suffering? No. He can test the effectiveness of this by giving an intervention. So yes, you're right in the last statement, but yeah, it's a mixed method as well. Good. What are the respiratory challenges of children living in Obajana? Yeah, not deeply. So let's go back to our slide. In the last, one of the description I gave, I said, when you want to develop research questions, you should focus on who, what, when, how, and so on. So if we want to look at, okay, let me just give you 2 more minutes to respond before I start giving explanation. Yeah, Gunde, you are effect of exercise. We're not looking at that. We're not looking at that. That's not where we're going. Like I said, the first thing the question says is, tell us a research, give us a research question. Just one research question. I'll wait for, if there are 2 more responses, I will just go into explaining the question first before we answer it. Researcher wants to know the respiratory challenges in children living in Obajana. Do you think that's what he wants to look at? Does he want to really look at that? Okay. What is the relationship between respiratory challenges and health impact of exercise? Regina, you've shifted from our direction. You've shifted from there. Okay. Can I go into the question so that we now answer it together? Can I go into it? Can exercise improve respiratory function? Yahaya, no, I don't want it. What we said, will exercise, can exercise improve? So let me go into it. Thank you. I love you all. You guys are excellent. I really enjoy what you guys are writing, and it's a good effort. And for those who are not yet in postgraduate studies, you can see the business awaiting you. And I know probably to some extent this will shake you a bit. So let's look at it. We said Mr. Ruben is a postgraduate physiotherapy student trying to specialize in cardiopulmonary physiotherapy. Suppose he came up with a topic titled Development of a Model Exercise to Reduce Respiratory Challenges Among Children Living in Cement Industrial Area at Obajana, Kogi State. So the first thing I want you to look at in the question is that they said he wanted to develop a model exercise approach, right? And they say to reduce respiratory. So definitely he must have confirmed that there are respiratory challenges. So therefore his interest is not towards assessing whether there is respiratory challenge or not. He's not interested in that because he has confirmed that that exists. So now what he wanted to do is to develop a tool to reduce it. So for those who are saying that he will need to assess respiratory challenges among children, you see that there is no need for him to assess it because he has actually confirmed that it does exist. Now, his major issue is he wants to come up with a tool to reduce it. I believe I've answered, I've taken care of that aspect. Then the next is a development of a model exercise to reduce respiratory challenges. So it is confirmed that there is an existing or there are existing cases of respiratory challenges confirmed. And the effort is to reduce it. So, and these respiratory challenges exist among a particular population of children. So we know the population he's working on. He's working on children. Then where are these children located? Remember, we talk about, we should know the setting where the research is taking place. He's living in an industrial area of Obajana. So we know the location. Setting is also known. So now, what is the research question? So mainly, you first of all look at it. What are the keywords? Model exercise, a new exercise is a keyword. Development of that new exercise, developing it is also a keyword. Respiratory challenge or reducing respiratory challenge is also a keyword. Children is also a keyword. Location is an industrial area of Obajana is also a keyword. So going back to who, what, and whatever in terms of research question, where would you direct your your research question to? If I were you, I will first of all look at what is more appropriate for me to direct my question to. Do I direct it to the population? Do I direct it to the condition, which is the respiratory challenge? Or do I direct it to the outcome I want to assess? The outcome is equally the respiratory challenge, which means the disease and the outcome is about the same thing. So, in this case, the key question is there any form of exercise available for children with respiratory challenge in a particular place? That's question number one. Or would an exercise model be effective in reducing respiratory challenge? Would an exercise model be effective in reducing respiratory challenge? Is there any existing model of exercise for children with respiratory challenge in this place? So you're actually looking at, the first thing is you want to know whether that particular tool exists. Or would developing an exercise model reduce respiratory challenge? Would developing, if you develop it, would it be effective in reducing this condition? So there are many ways to approach it. So that's case one. Let me look at some few messages came in. I want to see what is written so that. Yeah, the last person, okay, right? Research design is quantitative design, randomly selected. Okay, this is too difficult to understand. Mr. Okeke, you did well. Would an exercise model reduce respiratory challenges among children? This is a good question. This is a very good question. So the main thing is you want to see whether developing a model exercise would help in reducing what? Respiratory challenge among children living in Obajana industrial area or cement industrial area. So that's case one in terms of research question. So what is case two? I think the case two is talking about what is the case two talking about? I think it's talking about the research design. Certainly the research design is a mixed method research design. We are going to have to develop the tool. Development of a tool is actually a process of qualitative approach. So I explained Delphi to you when I was giving explanation the other time. So definitely developing the tool is a qualitative approach that we are going to use in developing the tool. And to now test the tool, we have to go using experimental approach. So experimental design will be used in testing the tool. So that's also there. I don't know. I can't remember the third question. Okay. So what research design will he use to develop the tool? Qualitative is what he's going to use to develop the tool. So the research, what research design will he use to develop the research design? He's actually going to use mixed method. How will he test the model he developed? He's going to conduct an interventional study. So he's going to use interventional study in case where he's going to have a group of them that will go through the model exercise and a group that will not go through the model exercise. And he will now compare the two groups and come up with the final findings. So this is the explanation to that question. I don't know if, is it clear? Is my explanation clear? You can indicate yes or no so that, is my explanation clear? If you are confused in any of the explanation, let me know. So I hope we gain something from this question as well. How will he test the effectiveness? Yeah, to test the effectiveness of the model, he's going to conduct an experimental study. Yeah, question one is like what I said is that, he said he was going, Chimeluma. Yeah, Ude, what we said is that, he's supposed to have a research question. And the primary thing he wanted to do is to develop a tool. So the question is, would the development of the tool aid reduction? Would it bring about reduction in the respiratory challenges. So that's the main question. Would development of the tool aid reduction of respiratory problem? This is the main thing. You know, he said he wants to develop a tool. So is there any need for him to develop it? That's the question. Is there any need? So since the question is there any need, is that would developing it be useful in reducing respiratory challenge? I hope this answers your question. Thank you. So can we proceed to our whatever now? Back to our slide. Back to our slide. Okay. Sorry, give me a minute, I'm coming. Okay. So we're back to our slide. Please, you need to pay a lot of attention here. This area is very, very challenging, a bit difficult for students to quickly get, but I will try as much as possible to make it a lot easy for you to grab. Some common clinical quantitative research designs. So these are research designs. Why do we conduct research at clinical area? And what are the areas to focus on when it comes to coming up with research design, quantitative research designs in clinical area? So, a researcher can decide that he wants to focus on therapy, he wants to focus on prevention, or he wants to focus on intervention. So your research can be basically the reason why you want to conduct is to come up with a therapy, is to come up with a prevention of a particular thing, or to come up with an intervention. This could be one of the reasons for conducting a research. Another reason is for you to diagnose whether something exists or not. So the main reason for conducting the research is diagnostic reasons. You could also write to conduct your research because you want to know the cause of a disease, looking for the etiology of a disease, the harmfulness of a particular condition, the risk factors of a condition, the mechanism of a particular disease or injury. The other time when we are talking about somebody who missed his step and probably suffered ankle sprain, we said it's possible you may say, what did you step on and all that. So it's about trying to get to the root of the matter. What is the mechanism of the injury? So one of the major reasons for conducting a research will be probably because you want to determine prognosis. Does adding ABC make the patient recover faster? And so on. So you may be interested in prognostication. Again, you may like to describe situation or prevalence of a particular thing, may be the reason for you to conduct a study. Then you may be interested in conducting a systematic review. You may equally be interested in making economic evaluation. For example, comparing costs of managing, let's say, facial palsy. To manage a facial palsy for a particular duration, what amount of money do patients need to spend to be able to manage their facial palsy? Now, how important is it for us to know the cost of managing a particular condition? Assuming a government decided that we want to give free healthcare delivery, and you are trying to tell the government that the money you will spend is this amount. The question the government will ask you is that, how did you arrive at this amount? If you have conducted an economic evaluation of a particular condition on how to manage it and the amount spent in managing it, you will easily present your findings to the government and say that this is the result of an evidence of what you spent to manage facial palsy. Therefore, if you are going to create a free health care service, each hospital, the minimum number of patients they see in a year that have this condition is so amount. They spend so amount to manage one particular patient. So therefore, if the government wanted to introduce free healthcare, they must make provision of that same amount or even more, because you are entering into another year, probably there could be inflation and so on. So we are calculating 10% inflation based on our findings, and therefore you are going to pay this amount to the hospital for us to offer free facial palsy care to the patient. How do you get to do that? Until you do economic evaluation researches. So this is one of the area of research that is also very, very important. And researchers are focusing on it a lot in managing patients. Again, it may not necessarily be a government that is asking for that. A person, somebody suffered, there is an elderly woman who was walking awkwardly because of serious or severe back pain, excruciating one for that matter. And one philanthropist in their area noticed how this woman is walking. And he was like, no, I'm ready to pay for her health care. I want to pay for her treatment. So he approached the hospital and said that, I want to know how much does it take for me to, for this woman to be treated all year round for 1 year, for 1 good year. And the hospital started saying, hey, Department of Physiotherapy, please tell us, what does it take to manage a patient with this level of back pain in your department? Because somebody wanted to pay. And you guys were like, we don't have an idea. Let's start checking. Why do you need to check? If you have actually conducted the research and you have an answer to that, you just say, based on the findings of the research we conducted at so time, it takes so amount to manage a single case of back pain. For that regard, for that reason, we are suggesting that the hospital should write the person and say that this is the amount he needs to pay. If you want to calculate inflation rate, and you say, based on this inflation rate, this is the amount he's going to pay. And this eases everybody's affair, and we are able to move forward. So let's start with therapy interventions for prevention study. A study intended to evaluate the safety, efficacy, or effectiveness of an intervention, such as educational or behavioral interventions. They are tagged or termed as therapy interventions for prevention studies. If the intent of a study is to evaluate the safety of a particular thing, how safe is it to administer so drug or so exercise to patients that have so problem. Recently, a student made a presentation and the student wanted to check the effectiveness of an exercise approach in managing epilepsy. And you know, one of the major things the major question that came up is that, how would you ensure safety of the group of your patient? So that indicates how important it is for us to know safety studies that are focusing on safety. They are also part of important studies that are being conducted. If a study is focusing on evaluation safety, effectiveness or efficacy of something, or education or behavioral changes, they are all tagged as therapy intervention or prevention study. The study could include healthy people. It can be conducted among healthy, apparently healthy individuals. Sorry, I'm saying I don't know what happened. Something just happened. I'm sorry. Can you see my slide? Can you see my slide?
Yes, sir.
Okay, let me continue. It can be conducted among apparently healthy individual, patient, or healthcare providers as subject, or it can be even conducted in the community. So anywhere we can actually conduct a study that is based on therapy, intervention, or prevention study. It includes studies labeled as pilot studies, preliminary study, or feasibility studies. All of them can be conducted under therapy. And I know from some of you have heard about pilot studies, preliminary studies, or feasibility studies. So therapy stroke intervention prevention study design features of these type of studies is they are usually prospective in nature. When we say prospective studies or prospective cohort studies, they are studies that are conducted, let's say live. What I mean by live is that you start it from a particular period and you monitor it as you develop in the study. It is not a study that came from yesterday. We want to see what happened yesterday. It is an ongoing study, so we call them prospective studies. They are usually they usually engage in randomized allocation. So you usually have groups where subjects are allocated at random. If randomized, concealed allocation. If the randomization takes place, the allocation should be concealed. It should not be open to certain categories of stakeholders in the study. For example, the outcome assessor, which I explained earlier, should not be aware of the groupings so that does not interfere with his work. If not randomized, steps taken to make sure the groups are as similar as feasible with respect to important prognostic variables at the start of the study. So if it is a quasi-experimental studies, you should equally make sure that there are steps that you use to ensure that bias does not enter into the study. So we talk about therapy, intervention, and prevention study design, which is the one we are talking about. So you have patients, you have clinicians, you have investigators, masked, stroke blinded to treatment to the extent feasible. Now you can have a situation where you blind patients, or you blind clinicians, or you blind investigators or assessors in the experiment. What do we mean by blinding patients? In blinding patients, we mean that if there are two groups or even more, the patients in each group does not know what the other patients are going through. If you have an exercise group and a non-exercise group, people that are in the exercise group do not know that there are some other people that are not going through exercise. And those that are not in non-exercise group, they equally are not aware that there are people that are going through exercise. Or even if they know that those people are also patients, but they don't know that they are doing different things. We all belong to this experiment, but none of them is aware of what the other person is going through. Again, the clinician that is also delivering the treatment or investigation, we do not allow them to be aware that there are different groups. So they are equally not aware of existence of different groups. Investigator or assessor, it is necessary that consistently the assessor must not be aware of the variation in the groups, so that does not create bias in reporting the findings of the research. So we talk about outcome evaluators, which are the assessors. Group treatment, groups are treated equally. Now, if you are conducting an experiment, remember I gave you an example earlier about group A going through traditional exercise without instrument, and group B who are doing exercise with instrument. I gave you that example earlier. So suppose we have these two groups. If the duration of exercise in group 1 is 60 minutes, group 2 must equally have 60 minutes. You can not be conducting an exercise where we say one group is receiving 40 minutes of exercise and the other is receiving 60 minutes of exercise. And at the end of the day, you want to compare who is better. You have already made one better. So you cannot be surprised about findings that indicate that those who did 60 minutes of exercise are doing better. So this is it. So the group must be treated equally, apart from the treatment under investigation. So all the groups must be treated equally. Okay, inter-observer reliability of the test evaluated if a test or evaluation is being used. Now, if you have a test or evaluation, for example, we want to assess the respiratory, cardiorespiratory fitness of a group. And we have two assessors, two people to check whether there is improved respiratory fitness. Usually, if both of them are well trained in assessing respiratory fitness, and they take, what do you call it? They take the assessment, we may not necessarily see variation in their findings. But if they are not equally treated, I mean, what do you call it? Trained, you could see variation. When this person is reporting findings that patients are improving, the other guys may be reporting that patients are not doing good because he doesn't know how to take the, what do you call it, assessment correctly. This could be one reason. The other thing is that if the tool we are using is reported not to have good inter-rater reliability. What we mean by inter-rater reliability is that when two raters use the tool in assessing something, they are not likely going to get the same result. So the tool does not have good inter-rater reliability. So if you now use two different raters, then you should be expecting great variation in the findings. So in a tool that does not have good inter-rater reliability, you don't need too many raters to rate. Instead, you use one rater to use that particular tool in rating the subject, so that there will be consistency in the expertise in assessing that particular outcome. Follow-up of patients after treatment sufficiently long and complete to identify important benefits and hazards. So if we do an experiment or give an intervention, and at the end of the treatment, we say the intervention is very effective, everybody will believe us and start using the intervention. But then, does the effectiveness that we notice, does it last long? For example, after we stopped using that drug or that exercise, do patients remain the same? The improvement we see in them, does it remain the same or it declines? We cannot know whether the improvement will increase or would remain the same, or the patient would decline until we have a period of follow-up. So after the period of the experiment, you give a long period. Particularly, it is recommended that the least period you can leave to come back and check after stopping your experiment is 3 months. And the best is for you, I mean, the next one is 6 months. But the best of them is for you to come and check the patient after 1 year and see that we treated you with this, you improve like this, and we want to see whether the improvement remains the same. So the period that you leave the patient after the first exposure is a period that we call a period of follow-up. You go back to assess the patient again. Then we have unbiased stopping rules for ending the study and power calculation for planned sample size. So to determine your sample that will participate in the study, you need what we call sample size. And it is good for you to do a power calculation. Use an experimental method in determining the samples that will participate in the study. This may come in our discussion, but definitely not today. Intention to treat analysis. Analysis of all patients in the group to which they were randomized for management trials. So when you conduct the experiment, you need to come and as you assess the patient, you now want to calculate whether there is effectiveness or not. So there is what they call intention to treat. Intentions to treat is making sure that the data of all the patients that you recruited and you assess at baseline is included in the experiment, whether or not the patient actually participated in the experiment, or the patient stay in the experiment to the end of the experiment, or the patient is available for follow-up or not. What do we mean by that? If we recruit group of patients and we decided to assess them at baseline, baseline means before we start the exercise. So we assess them for respiratory fitness. What is their level of respiratory fitness? And we recruited 15 subjects. So we assessed their level of respiratory fitness and we documented it. Then we started the experiment. Before we start the experiment, 2 of them did not come back to join us in the experiment. So we continued treating 19 of them, or training 13 of them, I mean, out of 15. So when we are done with the treatment, we now wanted to assess the effectiveness of our treatment. And 1 person did not come back for that particular assessment, though he received all the treatment. So we now ended up having 12 people that we are able to collect their data. Out of 15, we are left with 12 people. So we collected their data. Then we decided to give 6 months of follow-up. When it is the period of follow-up, we now assess the patient and we realize it is only 10 of them that are available for follow-up. So you see, at the end of the study, we ended up having only 10 people and 5 are no more in the study. So the data we collected from patients at baseline, data we collected after the experiment, and the data we collected during follow-up, all of them are going to be used in the analysis. We are not going to say because 1 patient did not participate in the main exercise, even though we take his baseline, we are not going to include that patient. No, we are going to include the data of the patient. We are not going to say because 1 of them we did not take the outcome analysis, follow-up result, we are not going to say that we are not going to use the data of that patient. We are going to include the baseline of that patient. So you can see that 2 patients, we are forced, or 2 or 3 patients, we are forced to be using their baseline data. Then finally, we now have only one patient also missing, or 2 missing during follow-up. Now, for those patients, we have their baseline and we have their outcome. So some patients have only baseline, some patients have baseline and outcome, while some patients have baseline, outcome, and follow-up. All of them, we are going to include their data in the analysis. Including all these data, even though some patient did not complete the experiment, is what we call intention to treat. Intention to treat analysis. I hope this is clear. This is where I think I'm going to stop completely in this exercise, or probably I add this just to, let me finish up with the next slide. Unfortunately, the time is not enough. Whenever I'm giving this type of lecture, I request individuals to participate for a marathon of 2 to 3 days, so that we can be able to do as much as possible. You can see what we have covered now is just a little, but then I hope it is useful to us. So we can actually do this study in pilot studies, a clear and credible plan for definitive study to address the study question. So for example, the question we gave, that we say development of a model exercise, we can test the model through pilot study. We recruit a group of subjects that we are going to administer the exercise to, and we have a group of subjects that are not going to go through the exercise, who are going to serve as a control. Then we compare the two. We'll be able to conclude whether our model is working or it's not working. In a drug or device studies, subjects in both groups provided all care that is considered to be routine and of proven benefit. So if you are going to do, you are coming up with a new drug or a new exercise model, you cannot ask patients not to take the regular form of things that they are doing. For example, for diabetic patients, they are already on insulin. Why would you say, I've come up with an exercise and it can knock out your condition, stop taking insulin? If anything happens, you are going to be in prison. So allow the patient to continue with the insulin, introduce your exercise model, and check out whether your exercise model has actually improved the level compared to those that are taking insulin alone. So this is how we do experimental studies. We do not stop the primary treatment. That is why usually they will say there is a usual care and there is an intervention group. In drug or device studies, evaluation is in an appropriate spectrum of patients, like those in whom it will be used in practice. So when you want to test an experimental drug or an exercise group, make sure if you implement that particular thing in a group of patients that you know you are creating the model for. You cannot go and say an exercise you are creating for elderly people, and you now try to test it among youths. And after you say that it is very effective in youths, then you say you want to apply it in elderly people. So, which means you want to you want to be murderous. You want to become a murderer who is going to kill as many people as possible, because that exercise is not meant for them. So if you want the exercise to be used in a particular group of people, test it among them. The effectiveness you see in it means that it will be effective in that group. If you did not see effectiveness, which means it is not going to be useful for that group. You cannot use it on a different population and apply it on a different population. Thank you very much. I think this will bring us to the end of the session for today. I don't know this is as far as we can go. And I hope we are able to learn one or two things. Thank you very much. Any question for me before we draw a curtain? Any question? Any comment? If you want, there is something that we want us to improve in the way I deliver the lecture. If it is difficult for you guys to get certain things, if I'm too fast, if I'm too slow, if it is too elementary as well, you can give your whatever. Oh, what do I mean by randomize? Good. I'm going to say randomize means you pick at random when you are allocating to different groups. If you have two groups now and you have recruited the subject, so you cannot selectively say that you group this, you go to this group, you go to this group. You can do something like a ballot, and you now ask people to pick. Whoever pick group A will go to group A. Whoever pick group B will go to group B. That is what we mean by randomize. Miss, I think it's Miss Ruben. Yes. Thank you very much. Thank you very much. Yes. All right. I'm sorry.
I raised my hand. Raise my hand to speak.
Okay, please go ahead. Talk.
I raised my hand to make a comment.
Please go ahead. Go ahead. Talk.
Thank you very much, sir, for this. Okay. Thank you very much, sir, for this wonderful presentation. My name is Nelson. And
you are not very audible. Can you talk a bit louder?
A wonderful time. Okay, I said my name is Nelson Ole. I have followed through in this presentation from the beginning till now, and I have personally enjoyed your mode of presentation. Like you said, it is not elementary, because there are some of the things we thought that we knew, but we are seeing it from a different perspective. Myself, I speak for myself. And I do hope that we'll continue with this series So at the end of this presentation, if we can have access to what we've done so far, to enable us prepare better for the conclusion of the other series. I will so much be delighted to have that. Thank you so much.
Thank you very much. Any other comments? All right, Udu, yeah, we surely need more time to cover more ground, definitely. I will talk to Dr. Samani, and I think they will give, they will provide a platform for us to add to what we have done today. Yes. Yeah. Thank you, Oladejo. Thank you, Gloria. Yeah. Thank you, Ransom. Thank you. All right. A big shout to all of you. Thank you very much. And I truly appreciate each one of you for your comments and encouragement. We shall be having other sessions. I believe I will speak to Dr. Samani to make arrangement for further sessions. If I give you this slide the way it is, you may have some few challenges. Probably, I think recording, I don't know who is keeping the recording, but I think Dr. Samani will have it, and I will tell him to share the recording. He usually keeps the recording, so he's gonna share it. Yeah. Thank you. Thank you. Yeah. All right. So we'll see what we can do to boost. I mean, increase on the timing. Usually, a session like this is supposed to be for like a week or so, where we take some few hours and deliberate and see what we can achieve. Then we give some take-home assignment, and you can submit. I can go through the assignment and I make some comment on your assignment. And because I always believe that knowledge should be shared as much as possible, and we should develop as many researchers as possible. The main thing that is taking physiotherapy to places is actually research. That's where we are respected. So if we don't engage in research, we will definitely be forgotten as a group. So thank you very much, everyone, for participating, and have a lovely evening. Bye-bye.
Thank you.
Bye. Thank you. Thank you.
Thank you very much.